Hi, everyone, and welcome back to the Sex Advent Calendar, 25 Days of Sex Education, all through the month of December. I'm Bianca Palmazzano, the owner of Intimate Health Consulting, and today we are talking about trans family building. So there are lots of ways to build a family, but I want to give a very brief overview of two specific options: adoption and fertility treatment. So there can be a couple of hurdles to adopting as a trans couple, but one of the big ones is finding an agency that works with queer and trans people. Now, in an ideal world, everyone would be trans affirming, but we know that that is not necessarily how the world works. And the process of adoption requires that a social worker visit your house numerous times and get very involved in your personal history and the relationship that you have with your partner. So that means that hiding the fact that you're trans is absolutely not an option. It will come out at some point during the interview process, and you want to find an agency where that's not going to hurt your chances of being able to adopt. Now, some states specifically have religious refusal bills enacted, which allow businesses and in some cases foster and adoption agencies specifically to deny service to queer and trans people, which is just ridiculous and terrible, but it is the reality that we're living in. Mississippi even has an active ban on queer and trans people adopting. That ban was ruled unconstitutional, but that doesn't mean that the practice is actually stopped. So you would have a very difficult time accessing adoption services in that state. That being said, there are a number of resources, which I will link to below, that can help you access trans-affirming adoption services around the country. Among others, the Human Rights Campaign has a specific project aimed at providing trans competency to adoption agencies, and they have a full curriculum available for agencies that want to be able to better serve this community. So if you work with an adoption agency and you'd like to up the quality of the service provision that you're giving to queer and trans couples, definitely check out their information below. The second method of family building that I want to talk about is fertility services. And there are a couple of steps that go into finding an appropriate fertility service and getting to the point of having a baby. So the first thing you want to do is figure out who is donating what genetic material. So depending on what the composition of your partnership looks like, you may be using donor sperm, a donor egg, or a surrogate gestational carrier. If a trans partner is giving genetic material or going to be gestating the baby, they will need to stop cross-sex hormones for a period of time, usually 3 to 6 months prior to donating. And if they're going to be carrying the baby, then they need to be off of their hormone therapy for the entire duration of the pregnancy. Sometimes trans individuals also have specific fertility issues that need to be addressed with drugs that aid in the production of viable eggs and conception. If you're part of a couple that can't conceive via intercourse, your next step would be intrauterine insemination or in vitro fertilization. IUI is the process of inserting a sperm donation directly into the uterus via a catheter tube. This is the least expensive version of fertility treatment, and it also tends to be fairly effective for couples that don't have any outstanding fertility issues besides just being trans. If, however, IUI isn't successful, or there's reason to believe that it would be more difficult to conceive that way, your doctor can also do in vitro fertilization, IVF, which is having a test tube baby. So a viable egg is removed from one partner's body, combined with a sperm sample in a petri dish or in another lab environment, and then reinserted into the partner that is going to be carrying the baby to term. This process can be fairly expensive, but it has also been majorly refined over the years. IVF used to be known for resulting in a lot of multiple pregnancies because you would get multiple fertilized embryos inserted into the uterus in the hopes that at least one of them would take. But now we've gotten so good at it that generally we can use only 1 or 2 embryos in order to get a viable pregnancy. Now, I'm going to include some resources below as well on how queer and trans couples can find a and affirming provider and explaining the elements of fertility services. And I highly recommend that you check those out if you are pursuing this process, because fertility care can be a very gendered experience, and so that can be very dysphoric for some trans people who want to undergo it. Finding a trans affirming provider can go a long way to making sure that you're not doing educating of your provider when you're trying to get this important service. I hope this video was helpful in giving you an idea about how to move forward with your family building options, and please do stay tuned for more videos all throughout December. Thank you so much and have a great day.